Hello, everyone. Welcome to the StellaLife Innovator series. I'm Liz Lundry, the Clinical Education Manager for StellaLife, and today I'm going to be talking to Dr. Homa Zadeh. Thank you for joining us, Dr. Zadeh.
Hello, Liz. It's a pleasure to join you and all of your viewers.
Yeah, thank you for making the time. I know you're very busy. Dr. Zadeh is a true innovator. He's an internationally known educator. You've spoken in over 30 countries, and your list of accomplishments is impressive. You've been a past president of the Western Society of Periodontology. You've directed the Laboratory for Immunoregulation and Tissue Engineering at USC. You're a researcher. You've worked with the National Institute of Health. You design instruments, and these are just a few of the contributions that you've made to the world of periodontics. So today, I'm really excited to share with our listeners and viewers what the Vista technique is that you've pioneered. So if you could please describe that for us.
Well, thank you, Liz, for giving this opportunity to share a little bit about what we do. Generally speaking, our approach is one of oral plastic surgery. So in thinking about what is oral plastic surgery, it's a kinder approach, more biological approach, respecting biology, respecting wound healing, respecting tissue health. So in doing that, the Vista approach is very much consistent with the oral plastic surgical approach because we're trying to preserve the blood supply during surgery. So typically there are different ways to manage soft tissue augmentation, either using a flap or making a tunnel through the sulcus of the teeth. With Vista, we are making a tunnel, which is basically making a remote incision from an area distant from the area that is being treated, and then creating a tunnel and preserving the blood supply in the targeted area. And that allows us to mobilize the tissues, bring the tissues up to cover the areas of recession or other deficiencies, contour deficiencies, and we can place a variety of different graft material, including some biologics, growth factors, and so on, to apply that for the treatment of gingival recession, dehiscences around implants that lead to the equivalent of recession around implant, which is mucosal dehiscence, or contour deficiencies. We can also use it for bone augmentation, for immediate placement, management of extraction socket, a variety of different applications.
That's wonderful. And I actually have had the opportunity to attend a couple of the courses and was just really impressed with, the way that you speak and present the materials. Really, I mean, as a clinician, I love this stuff. So I thoroughly enjoy that, but also the long-term results of this technique with the aesthetics, the longevity and the function, that's really very impressive. And it's just such an elegant technique. So I think you're going to be sharing a video with us today, so we can get a quick peek at that.
I can. I would like to share with you, this is a patient who presented to an orthodontist for treatment of gingival recession prior to orthodontic treatment. So the approach is called phenotype modification therapy. We utilize a variety of biologics such as PRF. So we usually start our procedures with a blood draw, isolating the platelets and mixing that with a scaffold of our choice. This happens to be a collagen scaffold. We usually add also to that some other biologics such as recombinant PDGF. This patient is about to start orthodontic treatment. So one thing that is very important today is the approach of phenotype modification therapy, changing the patient's phenotype from a thin to thick. So in addition to covering those areas of recession, we're trying to make the patient's phenotype into a thick phenotype. So you can see the vascular supply to the area. These are the areas that usually go from vestibule toward the gingival margin. So in our approach, we try to not to to try to compromise those and preserve them to the best we can. So we make a vestibular incision. This is particularly sensitive in the mandible because of the presence of the mental foramina.
Right.
Once we make that, then we make our tunneling from the vestibule toward the gingival margin. You can see that as we go into the gingival margin, you see these areas are very, very tight, have a very limited space. So we're trying to utilize these Vista instruments that are designed specifically for this purpose to create a tunnel under the mucosa. And the approach is basically to try to keep the mucosa and periosteum together, mobilize all of them using these series of instruments, so we won't go through all of them. And then the other aspect of the key is the suturing, because as we coronally advance the tissues, we want to stabilize the gingival margins using flowable composites and sutures to keep them attached to the teeth. So this allows us to coronally position the tissues and stabilize them using flowable composite. So these are all plastic surgical concepts of wound stabilization, not disrupting the blood supply, and supporting the patient during the healing. So we're very happy to utilize the StellaLife products that are available to support the patient's wound healing and recovery. And that goes very well with the biologics that we use during surgery, because as surgeons, we want to use every advantage we can for us to stack the odds for our success. So you could see the biologics being delivered using this collagen and platelet therapy together. And then with all the tissues that are coronally advanced and bonded to the teeth, they will be immobilized, so the surgeon controls the gingival margin position during the healing. So you can see at the end of the procedure, the entire tissues are coronally advanced, stabilized, so the patient has very stable space. So this is also to create that protective space that's necessary to increase the mucosal thickness, to convert someone with a thin mucosal phenotype to a thick mucosal phenotype, so this patient can go through orthodontic therapy safely. So even though the objective is root coverage as well, that's not the only objective. We're trying to increase the mucosal thickness. So you see that we're also putting the PRF within the tunnel, and that also adds to the support of recovery to make sure that the patient heals with a minimized amount of inflammation, right, to support the healing. And the patient will start the StellaLife products prior to the surgery to prime their system, and then they would use it during the healing just to make sure that we are utilizing the natural supplements to support the patient. Adjusting the bite, and then just to show you the patient coming back after just a week to show the patient's tissue response after just a few days, to make sure that you check the occlusion. This is 1 week later. So you see, when you respect the blood supply, someone who had very thin mucosa, you see the healing progresses quickly and efficiently, and then we're supporting the patient during that process.
That's just beautiful, beautiful result. And I really was impressed also with the, years down the line, how the recession continued to be managed, and these root surfaces were covered, and the function was there as well as the aesthetics. So very impressive. So that was really cool. So tell us a bit about the courses that you have at the Vista Institute of Therapeutic Innovation.
Well, as you can see, I have a passion for teaching and education. So we are putting that into use. So we are trying to share this information with our colleagues around the country and around the world. So we have during the COVID, especially geared up our online education. That's become a very important component. Our participants are able to join us on demand to attend some of our courses, or during live events, either in person, but increasingly remotely. We also have the opportunity for participants to take the workshops at their location. So we ship all of the products and material that's necessary and the models to be able to complete the simulated exercises in their own facility. And that way they can learn, have a more flexible learning opportunity. We find that many people start taking the online courses and on-demand courses, and then they want to come in for in-person. So hopefully, as we're getting through this period of time of difficulty, more people will embrace the in-person, but to have a flexible educational opportunity, that's, I think, very helpful to make sure that our colleagues who are very busy these days are able to learn at their own pace and at their own terms.
That's amazing. And it's also a wonderful opportunity to share this great technique and this information with so many people. So we all really appreciate that. And you, as you joined me today, you shared with me that you had a wisdom tooth extracted today. So
exactly
I'm impressed, or yesterday.
24 hours ago, I had that done, and I had tooth number 16 removed, and I've been using the StellaLife products before to prime my system, and I have been using it throughout the day today as well. So I think, given that I'm talking all day long with patients, I think I'm doing very well, and I haven't taken a single analgesic yet. So
wow.
that is a great part of the recovery. So it's always good to, experience from firsthand yourself whatever recommendations we have to patients. So I've had Vista done to me. I've had, just about any procedure done to me. So I have sensitivity for our patients.
Yes. Now I've had surgery as well and did use my StellaLife kit as well. So that's wonderful. I'm so happy that you're doing well, feeling good. And I really want to thank you for taking the time today to share this information about your amazing course. And I'm looking forward to seeing you when you are starting again, February. You have some courses coming up, February 2022. And so all that information will be on our StellaLife.com website and the links so that everybody can learn about that and join us when we have these courses coming up next year. So thank you so much. And again, thank you for your time. And thank you everybody out there for tuning in today. And come and join us next time. We'll have another amazing, inspiring innovator for us all to learn from. And until then, please stay well and stay safe and stay very, very happy. Thank you again, Dr. Zadeh. It really has been a pleasure.
Thank you very much, Liz, for this opportunity to share this information with colleagues.
Thank you, everybody. Bye-bye.
Bye.